Welcome to the course on Nutrition and Planetary Health, presented by the Physicians Association for Nutrition and PANCO. This course provides an evidence-based foundation for how dietary patterns influence both human health and planetary health, and how this knowledge can be applied in clinical practice to promote healthy and sustainable diets. Let's begin with Module 1 on the health impact of diet, where we examine how dietary patterns influence the global burden of disease and how scientific evidence linking diet and health outcomes is generated and interpreted. Ready to dive in? Let's get started with Lesson 1. Before you begin this lesson, please answer the following question. This ungraded question is designed to get you thinking. If you are unsure, choose the answer that seems most likely to you. Approximately how many deaths each year are attributable to dietary risk factors globally? A, less than 1 million? B, 1 to 3 million? C, 5 to 7 million? D, more than 10 million? The correct answer is D, more than 10 million. According to the Global Burden of Disease 2019 study, approximately 11 million deaths per year were attributable to suboptimal diets globally in 2017. Does this surprise you? If diet contributes to such a substantial amount of deaths, why does it receive less attention in medical training? In this lesson, we examine how diet has become a major driver of global mortality and why this matters for clinical practice. Over the past century, global mortality patterns have changed substantially. In 1900, infectious diseases such as tuberculosis and pneumonia dominated the causes of death in many regions. Today, non-communicable diseases account for approximately 74% of global deaths. Cardiovascular disease remains the leading cause of death worldwide, followed by stroke, type 2 diabetes, and certain cancers. These conditions are influenced by modifiable exposures such as diet. The Global Burden of Disease framework estimates the number of deaths that would not have occurred in the absence of specific risk factors. In 2023, dietary risks ranked among the leading contributors to mortality globally, where 12.2% of all deaths were associated with poor diet. For clinicians, this helps explain why nutrition is relevant across several common consultations, especially where cardiovascular, metabolic, and long-term chronic disease risk is concerned. Now let's consider what counts as a dietary risk. A dietary risk factor refers to patterns of dietary intake associated with increased disease risk. Importantly, the leading global risks are not simply an excess of one harmful nutrient, but also insufficient intake of protective foods. The Global Burden of Disease study identifies major contributors, including low intake of fruits, vegetables, whole grains, legumes, nuts and seeds, omega-3, omega-6, fiber, milk, and calcium, and high intake of sodium, trans fat, red meat, processed meat, and sugar-sweetened beverages. In simple terms, the global problem is often not just what diets contain too much of, but what they do not contain enough of. These patterns are observed across regions, though specific foods vary culturally. The Global Burden of Disease study estimated the number of global deaths in 2023 attributable to specific dietary risk factors. Several important patterns stood out. First, the largest contributors are not single harmful foods alone, but low intake of protective foods, particularly low fruit and low whole grain consumption. Second, high sodium intake ranks among the top risks, largely through its contribution to cardiovascular disease. Third, across all dietary risks, the majority of deaths occur through cardiovascular pathways. This matters in clinical practice because it shifts the conversation from individual nutrients alone to overall dietary patterns and food quality. Dietary patterns influence multiple major disease categories simultaneously. That means diet is relevant not only to a single condition at a time, but also to the broader pattern of disease risk a patient is living with. High-level evidence syntheses show clear associations between dietary quality and the risk of cardiovascular disease, type 2 diabetes, certain cancers, particularly colorectal cancer, and all-cause mortality. A comprehensive umbrella review in The Lancet reported that higher intake of dietary fiber and whole grains is associated with lower incidence of cardiovascular disease, diabetes, and colorectal cancer. Conversely, high sodium intake contributes to elevated blood pressure, a leading risk factor for stroke and heart disease. Globally, cardiovascular disease accounts for the largest proportion of diet-attributable deaths, followed by cancer and diabetes. Diet-related risk factors are not abstract statistics. They are encountered routinely in clinical practice and shape many of the conditions clinicians manage. While dietitians play a specialized role in providing nutritional care, all clinicians have a role in recognizing dietary risks, understanding their clinical relevance, and initiating appropriate conversations and support for patients. To explore this further, consider 3 common clinical scenarios. Consider patient 1, a 58-year-old individual with hypertension who consumes a high-sodium diet. Now, the World Health Organization recommends less than 2 grams of sodium per day, yet global average intake is nearly double that. High sodium intake is a leading contributor to elevated blood pressure, stroke, and cardiovascular disease, the top diet-attributable cause of death globally. Therefore, reducing sodium could lower blood pressure and reduce the risk of stroke in this patient. Now consider patient 2, a 45-year-old individual with prediabetes who has low dietary fiber intake. Higher fiber intake is associated with improved glycemic control. Thus, consuming more fiber-rich foods can lower the risk of diabetes for this patient, along with reducing the risks of cardiovascular disease and colorectal cancer. Now consider patient 3, a 35-year-old individual with overweight and consumes a diet high in ultra-processed foods and sugar-sweetened beverages. Higher intake of ultra-processed foods has been associated with increased cardiovascular risk in large prospective cohorts. Substituting these foods with whole or minimally processed foods could help reduce weight and lower long-term risk of non-communicable diseases for this patient. Further, among all dietary risk factors, low fruit intake contributes to the largest number of deaths globally, according to Global Burden of Disease analyses. This underscores that increasing consumption of health-promoting foods is as important as reducing harmful ones. These scenarios show how dietary patterns contribute to several risks and diseases clinicians manage every day, making nutrition relevant in routine care. Nutrition is central to the causes, prevention, and progression of common conditions. Therefore, recognizing dietary risks and initiating conversations with patients is within every clinician's scope, not just dietitians. Before we wrap up this lesson, let's look at the key takeaways to recap what we learned. First, dietary risk factors contribute to an estimated 11 million deaths globally each year, making diet one of the leading drivers of mortality. Second, most diet-related deaths occur through non-communicable diseases, particularly cardiovascular disease, diabetes, and certain cancers. Third, the largest global dietary risks often involve insufficient intake of protective foods, such as fruits, whole grains, and fiber, as well as excess intake of sodium and some processed foods. And fourth, because dietary patterns influence many major diseases simultaneously, nutrition is highly relevant to everyday clinical practice, even in non-specialist settings. Before you move to the next lesson, let's assess your learning through a quick question. Based on what you learned in this lesson, answer the following question. Among the following list of dietary risk factors, which contributes to the larger number of deaths globally, according to Global Burden of Disease analyses: A. High sugar intake, B. Low fruit intake, C. High saturated fat intake, D. High cholesterol intake? The correct answer is B. Low fruit intake. Understanding that diet plays a major role in global disease burden raises an important next question. What does the evidence show about specific foods and health outcomes? In the next lesson, we examine the scientific evidence linking dietary patterns and major diseases, including how researchers estimate the health effects of different foods and nutrients. Thank you for watching this lesson. As part of the Nutrition and Planetary Health course by the Physicians Association for Nutrition and PANCO, you can now move on to the next lesson. We would value your feedback. Please scan the QR code on screen to share your thoughts on the course content and help us improve this learning resource.